So thank you. And it's a big honor for me to invite here in our patient advocacy seminar Dr. Pirmorady and Susanne Diehm, and they will lead our workshop. And I'm very curious what we will know about us and about everything. We will start with a short presentation. So please, the floor is yours.
Thank you very much. So, thank you. So I'm very glad to be here today, and I'm saying that really, really honestly. I want to present our association today. My name is Adak Pirmorady. I'm a doctor for psychosomatic medicine, and in Germany this is a really small specialization. And I'm a psychoanalyst as well, and studied cultural science. At the moment, I'm the head of the ambulance there. And yeah, I'm working a lot with Susanne Diehm. She will introduce herself shortly by herself. She is a member of our board in our association. I'm the chair. And now we want to start with a topic which is, we are dealing with creativity in medicine and culture in medicine. And now maybe some of you are asking, where is the connection between medicine and creativity? So let me try to give you maybe a new perspective together. So this is a young woman I brought. It's a statue of a young woman. Maybe some of you know her. This is the patron saint of Europe. This is Caterina of Siena. She's born in the 14th century. And at one point, she decided not to eat any longer. And she told her mother and father, Mom, Dad, I'm dreaming of Jesus. He's coming to me and he wants to marry me. And the father and the mother were maybe shocked, but okay. They decided to give her to the convent, and this woman is today the patron saint of Europe. She was a fasting saint at her time, and she calmed down a lot of conflicts in the church, and she avoided the marriage attempts of her family, so she don't need to marry at the end. So imagine now a young woman coming to the emergency ward in the Charité, and maybe they will call me if I'm on the ward, and they will say, here's a young woman, she's not eating any longer, and her parents say Jesus is coming in the dreams and ask her to marry her. So what would happen? I'm sure we would think as physicians and as doctors in the international classification of diseases. And we will say this woman has an F.550.0 disease, which means it's anorexia nervosa. So we put this young woman, and she will go directly to the psychosomatic ward, where we can check blood pressure, the heartbeat, and everything. We give her maybe Kalium, maybe we gave her calories, so she can be more stable and can gain weight. So why do I talk about Caterina of Siena in this example? I just want to show you and me maybe that medicine is always dependent to the culture we're living in, to the time we're living in, and to the system and the classification we are dealing with. So please, as patient, but also as physician, never forget to think about your human logical thinking. So we need it, because it's not about the international classification or other systems that we have. It's about the feeling that we have for our patients. Everything based on studies and knowledge that we have and our experience, but we don't have to forget that there are other aspects as well. Oops. So here you can see the Lascaux cave, and this is a picture from very, very early, long before maybe we can talk about culture in human beings. It's 17th century before Christ. And archaeologists said that the people tried to handle anxiety about the god of the underworld, and they tried to paint hunting scenes for being more secure. So they find an expression for anxiety very early. This is so special. And on the other picture, you see a shaman. She tried to heal patients or people with diseases with rhythm. And this is so old, you can't imagine. Knowledge that it's so old. And today, in 2022, sometimes physicians even don't think about such processes or holistic views or integrative medicine. And this is a pity. I brought these pictures. Maybe some of you know the blue one. And what happened while watching this picture is so interesting, because I'm sure we are all from different countries, different backgrounds, and watching this picture, we all know that is sadness. And why do we know that? It's because the color, it's because the facial attitude or expression of the persons. And this picture is from the blue face of Picasso. Maybe you know the history that his close friend committed suicide because of a love to a dancer, and unfortunately she doesn't love him or something, and then he committed suicide. And Picasso started to paint some pictures in the same mood, always blue, with this expression. And what happened when we are watching it, this is the power, this is wonderful. When we are watching it, this is the power, this is wonderful. My English is not perfect. You coming maybe from other countries, and we are here together, and we have the same feeling just watching a picture without any words. And this power and this feeling, we need it, because this is honestly, and we want to integrate that more and again in medicine, something which was there always in the past. And maybe it's lost now sometimes. In the middle, this young girl, maybe you know her, or do somebody know her? Yeah? Who? Yeah. Yeah, exactly. This is Frida Kahlo when she was really young. And here on the right hand side, you see a picture of her. And maybe if you know her, you know her history. And she had a big accident when she was young, and she lost a baby, and she had a really strong relationship to her husband. And she always tried to canalize the power and the sadness and the pressure by painting. And there are wonderful artworks from her, but also when we are looking at the pictures, sometimes they're not just easy. We can feel the pain when we see the pictures of her. So I think if we want to talk about healing processes or about good medicine, then we have also think about the psyche. There's no possibility, because health needs the integration of the psyche, also like the integration of the body, that's clear. And Sigmund Freud gave us, with his second topical, how psyche works. So every one of us is individual, this is obviously, but we have things which are more or less universal to every one of us. And maybe you know the first topical model of Sigmund Freud. It was just an iceberg, with the top of the iceberg was very small, and the rest was under the water, a huge iceberg under the water. And he said that the most decisions that we have during our day are this topic of the iceberg. It's just 10% of what we do every day is really consciousness. We do it by consciousness. The rest is unconscious. And then he developed this, and he said in the human psyche, we have the impulsive part. This is the es. You can see here. No, it's not working. You see the es, and the es is everything which is biological. Yeah, this is sexuality, aggressivity, destructivity, or sometimes hunger. And we have the overself. And the overself is everything that we learn from our mother, father, from our grandmother, what the society teaches us. And as you can imagine, these two powers inside of us, they have very different aims. And the idea is that these instances are fighting all the time. But we are not recognizing it because we don't need it. If we are working or if we bring the children to the school, we don't need the fight between instances inside. It's not interesting for nobody. And it's, in contrarious, it's disturbing us. So what happened? Our psyche is very good. It helped us everything in the unconscious part of our psyche. The ich and the self manages those conflicts between the instances. And so the ich is the only part that really makes our personality. And what we want to do, to make this self stronger and to know more about this self, because this self gives us our individuality in this whole thing. And now the problem is, if there is so much conflict and so much power in the unconsciousness, then we have really problems, because these powers are there and they are, in a way, they are unconscious, but there is tension. And we need to get, at the end of the day, or to feel relief of these powers. And if we want to have healing processes in our patients, we need to help them to relieve this tension. And that's why we think as the association that it's so necessary to work with these powers inside, which is talked a little bit, and this is maybe the theoretical base. But I can talk the whole day with you here, nothing will change or happen. We know from the neurological or neuroscience that if I want to give you a message, if I want to create something new, then I have to touch you. And I heard you talking last time when we were in the restaurant, and this is what we need. We need emotions and we need to touch. And that's why I'm so glad that I have the possibility today to be here with Susanne Diehm, because she is touching people in her creative writing sessions. And this is what happened to me. So I'm a psychoanalyst, and I did a long time therapy, lying down, and my psychoanalyst behind me asking questions and saying things. And then I was in a session with Susanne Diehm, and it was like magic, because she touched something, and I was so impressed because of this feeling that she created. And this is something that depended to our brain, because we know the neuroplasticity of our brain. It works good if we have feelings and we have emotions. And that's why I'm going to stop in a minute to talk, because you need this experience. You need that, and we will try to give it, or Susanne will try to give it to you. So shortly, just at the right-hand side, we know that if we have pressure, if you have tension in the system, then the pressure comes from the brain, from the hypothalamus, hypophyse, Nebennieren, Rindenachse, and the hormones will change in our body. And this is also a base sometimes for stopping healing processes or for infections in the body. And that's why this is what we have to be aware of. So our association is doing a lot of things. We try to show evidence-based that creative therapies are necessary and important. We have a lot of books. We have published books with Susanne together and with Professor Seuli as well. And we try to bring this knowledge, which is really old, nothing new, but we try to bring it more to the German society. At the moment, we are located here in Germany. Because it's funny, it's so old, but sometimes the people are they're interested, but also they say, how can it match medicine and culture? So, and that was, I tried to bring it together for you today, and so I want to say at the end of this presentation that we want to understand the unconscious behaviors because we think that it can help us a lot while healing processes. And channeling tensions is one of our aims in therapy, in creative therapy, in psychotherapy, and supporting healing process. And so at the end, we have hopefully a better outcome for our patients. And if we have that, we are also much happier and better doctors or making better medicine. So thank you very much for your attention.